All right, we are recording to the cloud.
Hello, everybody. Welcome back to Medical Monday.
Welcome back. It's Medical Monday.
Today's Medical Monday is a topic, actually two topics, but they always occur together.
They do. There's two different things.
Two different things, but
Similar.
they always occur together.
And different. Yeah.
They're the same thing, just different.
Yes, same difference.
Genuine imitation. Well, what are they?
Was sprains and strains.
Sprains and strains.
Everybody's favorite subject.
Yep.
Everybody's favorite subject. Everybody loves sprains and strains.
So if we get into what are strains and sprains, they actually occur together, but they're two different things. A sprain is what?
A sprain.
Which one are we doing? Sprain first?
Yes. Sprain is the tearing of a ligament.
Okay.
The sprain is the stretching or tearing of a ligament.
Stretching or tearing of a ligament.
Yes.
All right. And then
a strain is the stretching or tearing of a muscle or tendon.
Yeah.
Yes.
So they are the same thing, a stretching, tearing, but of two different things. One's a ligament, which this is a ligament.
Yes.
Ligaments hold bone to bone.
Bone to bone.
So when two bones get stretched apart from each other, like say an ankle injury where you twist your ankle, those bones in there stretch the connective tissue.
Yes.
And that is what a sprain is.
Yes.
The connective tissue from bone to bone.
Bone to bone. Just like in the back, you can sprain your back. Same thing. That is what we have here, is a ligament connecting one bone to the other in the spine.
So if a strain is a tendon stretching, how does that occur together? Because look, a tendon connects to a bone and a muscle. That's what actually connects the muscle to the bone to allow the bone to move.
Yes.
So the same concept, whenever those two bones that are close to each other, connected by ligaments, also have tendons on them that move them. If they stretch, both of them will have a tear.
Yes.
So a strain and a sprain, oftentimes, pretty much 100% of the time, occur together.
Yes. Yes, absolutely. So the muscle, the tendon, and the bone allowing that movement. Yep, you are correct. And they always occur together because a joint wouldn't move if it just had ligaments.
Exactly. The ligaments actually hold the two bones together.
Yes.
And the muscle is what moves those bones. All right.
movement.
So it's just like a lever process.
You are correct.
Very common injury. We see them a lot in the ER because there's always the fear. The fear of, well, what happened? Did I break something? And oftentimes that's not the case. About 15% are actual breaks. The other 85% are just very, very painful, unfortunately.
Yes, they are. That is very true. And one of the most common joints, our heads are covering it up, is the ankle. You already mentioned that. Yes. So the sprain and strain of the ankle, you can have the tearing of the ligament or the tearing of the muscle and tendon. It happens to lots of athletes.
Most of the time it occurs with indoor sports. When there's a lot of starting and stopping or quick motions, that's where that ankle unfortunately has a tendency to usually roll under, but sometimes it can actually roll out. But with that, that's where we get most of our injuries, like basketball, volleyball's a good one, racquetball. Think of those indoor sports where you've got good traction with your shoes. Unfortunately, that just means your poor ankle may roll, which is why it's the most common one. And we're seeing more and more with outdoor sports that are being played on
turf.
Yep.
Yes, I was just about to say that. Yes, turf. Turf is a very similar surface to what we see on indoor sports, especially with indoor soccer fields, things like that. But more and more sports on outdoor fields are changing to turf. And so
they changed the turf because you get better traction. Athletes love that. It's better traction and better for a cut, any type of motion. If you're playing football, you're playing soccer, you want to have that traction. Unfortunately, too much traction, that poor little ankle will just roll under.
Just avoid impact sports too.
No.
Like
we want to play them.
Who is up for a game of horseshoes?
No. We want to play them. We want to be active. But you got to be careful. You got to wear the right type of shoes. Oftentimes with strains and sprains, we're going to talk about the treatments, but it's about prevention too.
Correct.
So proper shoes, of course, proper stretching beforehand, things of that nature will really help to prevent them.
Yes, you are correct. And then also there's different ways that we can roll. You talked about how you can roll your ankle in. And so the different supports, the different surfaces, different directions that our joints move, we can sprain and strain those directions. So we did want to explain that. So with the ankle, it sits in a neutral position. You can roll it in or out with an inversion or an eversion type sprain or strain. And it all just depends on typically the activity you're doing, the sport you're playing, which is the same thing as the activity. But then also what you're wearing. If you don't have the proper footing or covering for the sport, it is very likely that you're more likely to get injured in that aspect. So,
and that's why when you go, we always talk about your mechanism of injury. How did it happen? I want to know, did your ankle roll in? Did you fall on your shoulder this way? Did you fall on it this way? That always helps us, because oftentimes the patient initially comes and they're very swollen, they're very tender. And it's not a very good exam just because it's very painful. So mechanism of injury really helps determine what we're going to do for you.
Yeah. And one of the best things you can do is start with home care. Unless you do truly feel that there's some type of a break or reason to go to the emergency room, it's typically a very similar approach to care at home until the swelling goes down and further imaging or further assessment can happen. With that shared, it is rice, baby.
Rice. But that's an acronym.
Yes,
we're not actually eating rice to get better.
No.
We're not putting rice on it to get better. It's an acronym.
RICE for rest.
Rest is always the first one.
You got to get off of it so that it can recover. So we've got to rest it. And then a very important part is ice.
Vanilla ice right there.
Did you put that slide in here?
I didn't put it in. But ice works very good.
Ice.
It helps bring down the swelling. Oftentimes when you have an initial injury, it swells. That's normal. That's natural. That's what the body does to heal, but it's too much. And that's why it swells and it's very tender and very painful. So ice will really help bring down some of that inflammation, the swelling. And it actually helps with the treatment plan because
the time frame.
The Journal of Sports Medicine noted the benefit of ice is significant. If you ice your injury within 36 hours of the initial injury, your recovery time goes from 30 days to about 14 days.
Almost half the amount of time in regards to the recovery. Such a huge aspect.
And it's an easy thing to do.
Very easy.
We think about an injury, rest it, put some ice on it. But there's some other things we can do too.
We got to compress it.
Yep.
We got to get the fluid and the swelling out of the area. So compression is a huge aspect as well. There's good swelling and there's bad swelling. The initial onset, the original 36 hours, is very important because that's the body processing everything and trying to actually recover and heal it. And then from that aspect, compression, elevation, ice, all designed around reducing the amount of time for the recovery.
And compression is very good too, because like you see this and here, they're elevated, but that compression device brings down some of the swelling, but also adds some support, because nobody's going to, whether you use ice or not, it's, 13 days or 30 days recovery. You're not going to lay in bed for that amount of time. No. Okay. You need a compression element that actually holds and stabilize that poor ligament, that poor joint space, because it's damaged and it's painful. So you want to have some compression that also provides support for you.
Yes, very important. Support. And we've talked about that to prevent it. Support is very important. Absolutely. So I've sprained my ankle. I've gone through all the ropes. I'm getting better movement, but there's still some discomfort and pain in there, Lonnie. What would be the next step in regards to typical care or things that would happen in
So typically, we look at these injuries, and like I said, there are a very high incidence of going to the emergency room. Because they go to the emergency room, they're really concerned about a break. We do some imaging and we don't find a fracture more than likely. But other than that, what's the typical thing that we do? We want to be able to prescribe some medication to help bring down that pain level and also bring down that swelling. And that's what we call, the acronym here is called NSAIDs, non-steroidal anti-inflammatory medications. It's anti-inflammatory. So we just want to bring down that inflammation, that swelling that's causing pain. There's numerous ones. You can get over-the-counter, Motrin, Aleve. Of course, there's prescription strength, naproxen, other things that you can take that would really help bring down this inflammation. They really should only be used for a short period of time. Unfortunately, if that's all that you're doing is the medication, sometimes it will linger much longer and you'll be taking them much longer. So it's got to be more of a comprehensive plan. Just medication is not going to fix the problem.
Very true. Very true. And that is part of our mission statement, right? We want to get patients out of pain, off pain medication, and avoid surgery. Surgery is needed all the time, every day. And so in sprains and strains, typically it's not necessary depending on the severity of the tears. But as with the NSAIDs as a tool, we also need to utilize that decrease in pain so we can challenge the area and strengthen, right?
Yes.
So physical therapy is a huge aspect of what needs to happen with a sprain or a strain, because we talked about, the ligament itself, it doesn't help move the joint, it helps to stabilize the joint, but the tendon and the muscle needs to be tightened and strengthened so that it can better support. So we do need to make sure that some physical therapy happens to strengthen and incorporate in that specific area to support through that process. When you sprain your ankle, the next joint up is the knee. So it's very likely that not just the ankle is affected, but also the knee. So just all areas of assistance.
And we see that, you know, like Dr. Gabby was talking about very regularly. If somebody twists their ankle, how are they walking?
Mm-hmm.
You know, they're walking in a non-natural fashion.
That's
so
how you
if you don't, in the morning until I get warmed up. But, you know, you think about when you're walking in an unnatural state, what is that going to do to everything above there? The knee, the hip, the back, everything above that area is going to have problems. Your body should function as one cohesive unit and not have an inappropriate walk.
That is very true, because I describe it as like a compensatory effect. There's a true compensatory effect when we have an injury. Our body's naturally going to avoid using that aspect of our body, whether it be riding, walking. I mean, there's just so many aspects. Breathing. There's a lot of details oriented with recovering from this and not making it fester.
Part of the recovery that we look at is actually platelet-rich plasma.
Mm-hmm.
So this is a phenomenal recovery tool that we have available to us, and it's their own patient's blood. We draw it, concentrate it down, and then this is actually, it's under ultrasound. So you can go right to the actual tendon
mm-hmm.
or the muscle, what is having severe pain and what is stretched and torn. We can concentrate this blood and put it directly into that tendon to where it heals much, much faster.
Yes. This is used by elite athletes, has been for a very, very long time, and now it's becoming more and more affordable and available for patients who are not necessarily extreme athletes to recover more efficiently.
And more and more of a common procedure.
Yeah, very common, more and more common as well. With the PRP in conjunction with physical therapy, exponential changes, right?
Yep.
You can just do physical therapy, you're going to respond, you're going to recover, you're going to get stronger when you combine these therapies together.
And like Dr. Gabby was saying, you know, more and more athletes, there's about 93% of all professional teams utilize platelet-rich plasma on their players because they want them to heal much faster because the next game is coming up.
Yeah.
And they need that player on the field. But you also need to be on your field of life, doing activities, doing whatever it is you want to do. And platelet-rich plasma is very affordable for normal people just like us. And it's very simple, but a very good response with patients. But it's always got to be added in with physical therapy.
Yes. And it's something that can be utilized in old injuries as well.
Yep.
Correct? Yep. Absolutely. Wonderful. And then also the adjustment. We talked about needing the physical therapy to help correct some compensation that's happened, the PRP to help strengthen and heal the tissue. The adjustment is a huge aspect in supporting the whole body in recovering through this process, either typically due to the original injury, causing getting tackled and having the ankle getting sprained, or in a basketball game, the fall, but just overall mechanical work of the body. All the joints can be adjusted, aligned so that it can work more efficiently.
We talked about that limp. Yep. If my ankle hurts and I'm bent over walking, what's going to happen? Everything's going to come out of alignment, and it's just going to be more and more pain. It's just like you're driving your car and you hit a curb. All right. You've got to get it back in alignment. Otherwise, you're going to wear one side of your tire much faster than what you should, because they're not designed to be at that angle. It needs to be aligned properly.
Yes, it does. It does. So that is our Medical Monday on sprain strain. I do hope that you learned something in regards to the same difference comparing the
same
two
difference.
The same difference. They're similar but different.
They're the same difference. Just different.
The same difference.
But great Medical Monday, and I hope you guys learned a lot, and we'll see you next time.
Yes, we'll be back next week.